Now, the burden of an increasingly globalized food supply and the rising number of foodborne diseases is calling for an urgent need to strengthen food safety systems, which is why on World Health Day today, the World Health Organization is drawing attention to the issue of food safety.
Unsafe food kills 2 million people annually, many of them children. Food infected with bacteria, viruses, parasites and chemicals cause over 200 diseases ranging from diarrhea to cancers. Which is why on World Health Day, the World Health Organization is promoting the message of safe food. With the slogan, "From farm to plate, make food safe."
Starting from where the food is grown, how it is plucked, how it is sold, how we purchase, then how we bring it to the home, how we store, how we wash, how we cut, after cutting, how we cook, after cooking, how we serve, after serving, how we eat, and after eating, how we dispose of the leftover. And if we are reusing it, how to reuse and how to reheat. All these factors at any level, if there is a disturbance, you will end up into a waterborne disease.
In India, most foodborne illnesses go unreported. Although data from 2011 to 2014 shows they alone are responsible for over 50% of disease outbreaks in this period.
Foodborne diseases, if you look into it, it has a very high rate in India, though we do not know the exact percentage of what it is. But since it is linked to water safety, hygiene, sanitation, all these issues, therefore we have to understand that all of them compile up to cause foodborne illnesses. So it is of very critical importance to India.
There are a lot of patients who are dying of liver failure, and they are dying of liver failure only because the quality of water is bad in Delhi. There is a lot of pesticides in the food, and which directly hits the liver. So I think it's very important that we have to look at the quality of water coming into our homes. We have to look at the quality of food, which means the amount of pesticides in the food. There has to be a regulation.
Harmful agricultural practices, poor hygiene and lack of preventive controls in food processing are causing many safety hazards. Which is why experts argue for suitable standards on both production and sale of street food.
Basically found is nutritionally excellent, uses local traditional food, not food which is unhealthy, local and extremely fresh because they have no place to store. But the problem is they do not handle it properly, the water they use is not clean, the garbage disposal is not proper, leftovers not properly handled, the display is not properly done.
Agriculture, food, with Ministry of Commerce, with Ministry of Health and Food Preservative Ministry. So all we have a meeting and we decided that we should work in an integrated way in such a way that food which is given, which is provided to the people, and how to regulate, how to avoid the contamination. By like mostly if you see children suffer from the diarrhea because food are contaminated.
This year, World Health Day is all about a safe and a healthy diet for all. It's also an appeal to collective government and public forums for suitable action on agriculture, trade, health, education and social protection. Anshu J. Singh's report for Rajya Sabha TV.